Hi, this is Dr. Chan here at Crown Dentistry. We've been getting a lot of questions about dental checkups, so today we're going to talk a little bit about that subject and hopefully we can answer any questions that you might have. So it's really important to make sure that everything that's going on in your mouth is happy and healthy. A lot of times people think that, if everything feels fine, everything is fine. We know that sometimes that is the case, but unfortunately, a lot of times that's not the case, simply because there are a lot of things that could be going on in your mouth that may not hurt or bother you, but are still potentially problems nonetheless. So that's why it's really important to get a dentist and or a hygienist to take a look at what's going on in your mouth and also get your teeth clean. For the most part, we like to see our patients at least once a year. That's once every 12 months, just to make sure that everything is happy, healthy, solid, and stable. Ideally, we like to see our patients once every 6 months. That would be even better, just because a lot of things can happen even over the course of a couple months. Studies have shown that it only takes about 30 days for a cavity to start forming in your teeth. So potentially even there could be things that we can find at a dental checkup that we didn't even see, even if we saw you 4 to 6 months ago. I would say for the most part, if we find something that's not ideal, either an infection or something broken in your mouth, it's always better to find it sooner rather than later. I can't say that if you're regular in your checkups that we'll find absolutely nothing, but it's definitely a better way to find something if it is there. So when we see a patient for the first time, there are several things that we like to do. First, we like to just get a full write-up of your personal health history. That means any medications you might be taking or supplements or vitamins. We also like to know just a little bit about your own dental and medical history. Like, are you being regular about seeing your medical doctor and getting physicals and lab work on a regular basis? We also want to know if you've been to other dentists recently and if you've had any work or procedures done. We also ask if there's anything in your own medical history, such as illnesses or procedures that have been done. Anything that's affected your body can potentially have an effect on your mouth. And so if we're going to take a look in your mouth and potentially do work if it's needed, we want to know everything that's already going on in your body before we get there. After we take a look at all these things, we like to do x-rays, ideally as many as possible, in order to show us as much of the mouth as we need. We're not just looking at teeth, we're also looking at your cheeks, your lips, your tongue, your hard palate, the roof of your mouth. We want to see if everything looks the way it's supposed to. We want to make sure there's no infection or diseases in there. Of course, we'll take a look at your teeth. If you have any fillings or crowns or any other restorations, we want to make sure those are in good shape and that, like I said, there's no potential cavities or infections brewing in there. We also like to take photos as well as, like I said before, the x-rays, just because it lets us get a record of what's going on in your mouth. And plus, when we're talking to you, we can show you how different things in your mouth look. And hopefully everything looks the way it's supposed to. We also like to do a cleaning on the first time that we meet you, unless there's a more pressing problem, just because it's always good to start things off with as clean and as healthy a mouth as possible. One of the things that I said that we're looking at is your gums and your soft tissue, as well as your teeth and other parts of the hard tissue in your mouth. One of the ways that we're trying to make sure that you're healthy is to make sure that your gums are healthy, meaning that there's no gum disease affecting your gums as well as the bone surrounding your teeth. So a lot of times we're trying to make sure that everything in your mouth is healthy. Obviously, we're going to look at your teeth. We want to make sure that there's no cavities in there. We want to make sure that there's no infection to your bone surrounding the teeth. We want to make sure your gums are healthy. Nothing is bleeding or inflamed. We want to make sure there aren't any bad odors or tastes that are present in your mouth. We're also making sure that any fillings or crowns or implants or anything that you might have had done in the past are all in good shape and in good working order. If we're seeing you for the first time, we usually like to allow at least 1 hour for a dental checkup. That includes an exam and taking x-rays. If we're also going to clean your teeth, usually we'd like at least another hour to do that. If we're seeing you not for the first time, like you've been a regular patient, a lot of times things won't take that long. But by and large, if we're seeing you for the first time, we want to allow at least a couple hours just to make sure that we can be thorough and complete. For the most part, dental checkups don't hurt because we're just looking. Occasionally, when we check people's gums or soft tissue or teeth, if there's something going on, like an infection or a cavity, things might be a little sensitive, but we will do our best to make it as comfortable for you as possible. If you want to make sure that things are healthy and happy in your mouth, please give us a call at 916-285-9678 or go to our website at www.crowndentistry.net. We're here to help. Thank you.